Hello everybody. Today I'll be discussing about Tubo ovarian abscess. Now the Tubo ovarian abscess is basically an inflammatory mass which involves the fallopian tube, ovary and other adjacent pelvic organs. Now the risk factors over here, the main three risk factors are that the patient is from the age group of 15 to 25 years old, if the patient has multiple sexual partners, and if there is previous history of PID. Other than that, the other risk factors you have is of instrumentation of the uterus and the IUD insertion. Now the etiology behind abscess. It is a late complication of PID, and the most common route is that the pathogens from the cervix, that is usually they are the anaerobic bacteria which usually cause cervicitis, they pass on to the endometrium. From the endometrium, they can pass on to the fallopian tube and then the peritoneal cavity and form a mass. Now the clinical features. So these patients are patients who have undergone sequelae of PID. So the question can come as a patient of 15 to 25-year-old age group has history of PID, symptoms and was treated for PID, and 1 week later the patient comes back to the GP and complains of having fever and persistent lower abdominal pain, vaginal discharge, there's presence of adnexal mass, and when we do her lab investigations, we find that she's having increased WBCs, or also called as leukocytosis. So the diagnosis in this case is tubo-ovarian abscess. So this is what your clinical features would look like. Now the investigation in this patient would be ultrasound, where you will see a multilocular mass. Tubo-ovarian abscess is a multilocular mass, and the treatment is that you give antibiotics, mostly cephalosporins. So this completes your topic of tubo-ovarian abscess. Thank you.